Hello everyone. Today I'll cover developmental disturbances of lip and palate. These are some developmental disturbances affecting your lip and palate like congenital lip pit and fistula, commissural lip pit and fistula, cheilitis glandularis, cheilitis granulomatous, cleft lip and cleft palate. So first developmental disturbance affecting the lip is congenital lip pit, otherwise known as paramedian lip pit, congenital fistulas of lower lip. These are other names of congenital lip pits. Pit means depression, right? So in the picture you see the arrow mark depicts the depression on the lower lip. These are bilateral lip pit which is present both right side and left side. Next is what are the etiological factors for congenital lip pit? So many authors suggested so many theories that causing lip pit. First is pit may result from notching of the lip at an early stage of development, or it can arise from persistent lateral sulcus on the embryonic mandibular arch. This sulcus disappear by 6 weeks of embryonic age. So it's a developmental disturbance, so it occurs in the early stage of the development. Clinical features of congenital lip pit. So what are you see clinically in a patient of lip pit? There is a presence of bilateral and symmetric fistula on either side of the midline of the vermilion border of the lip. You see in the picture there is an arrow mark that shows the lip pit present on bilaterally and symmetrically. Okay, these blind sinuses can extend down to a depth of 1.5 centimeter, may secrete saliva. There is some secretion, some salivary secretions are also seen in these sinuses. Occasionally a single pit is present or multiple pits are present. If a single pit is present, that may be centrally located or lateral to the midline. If it is bilaterally present, then it is present on either side, like right side and left side. If it is single pit, then it may be centrally located or on the lateral to the midline. These congenital lip pit, they are associated with two syndromes. First is Van der Rohe syndrome. Second is popliteal pterygium syndrome. Van der Rohe syndrome, in that you see there is lip pit along with cleft lip or cleft palate or cleft lip and cleft palate. Okay, so basically in Van der Rohe syndrome is you see both lip pit as well as your cleft. Okay, in the picture you see on the lower lip there is lip pit bilaterally and there is a cleft lip you see in Van der Rohe syndrome. In Van der Rohe syndrome, there is a micro deletions and at chromosome band 1q32 and q41. Then popliteal pterygium syndrome. So basically lip pits are features of this syndrome, and these are some clinical features of this syndrome. First is popliteal webbing, there is cleft lip or cleft palate, genital abnormalities, and there is a congenital band that connecting the upper and lower jaws, that also known as syngnathia. Okay, so there is a popliteal webbing, involvement of the popliteal region, as well as there is a cleft lip. Histopathology or microscopic feature of lip pit. You see the tract is lined by stratified squamous epithelium. There is some minor salivary glands that communicate with the sinus. and presence of chronic inflammatory cells. The second developmental disturbances of lip, that is your commissural lip pit. The name itself suggests the lip pit, they are located at the lip commissure. Okay. These are present at the corner of the mouth. You see in the picture, there is a depression, there is a pit on the vermilion border and present at the corner of the mouth. That is a commissural lip pit. So etiology, what are the causative factors for the commissural lip pit? Their location suggests that they may represent a failure of normal fusion of the embryonal maxillary and mandibular process. The location, that means they are located at the corner of the mouth, so it represents a failure of normal fusion at the embryonic time, that is during the development of the maxillary and the mandibular process. Okay, and they may represent a defective development of this embryonic fissure. Clinical features of commissural lip pit. The prevalence is lower in children, that is around 0.2 to 0.7% and more in case of adult, and it occurs at the lip commissure, as I already shown that picture, that present on the commissure or the corner of the mouth. They may be unilateral or present on the one side or bilateral. They mainly present as blind fissulas and it may extend to a depth of 1 to 4 millimeter. So clinically you see there is a pit or depression on the corner of the mouth. Histopathology, it is same as your congenital lip pit. There is a narrow invagination or the tract which is lined by stratified squamous epithelium, and there may be a presence of salivary gland duct. Coming to treatment plan for this lip pit, these are always asymptomatic, like the patient doesn't complain of any symptom. There is no pain, no tender, so there is no symptom. So for these kind of patients, there is no treatment is necessary. But in some cases, there is a excessive salivary secretion or secondary infection may occur. In that cases, surgical excision of the pit may required. Okay, so these are all about congenital lip pit and commissural lip pit. Based on the location, you classify congenital lip pit and the commissural lip pit. Like congenital lip pit is associated with some syndromes, most commonly Van der Rohe syndrome, but commissural lip pit is not associated with any kind of syndromes. So these are all about the congenital lip pit and commissural lip pit, and I will discuss other developmental disturbances of lip and palate in the upcoming videos. Hope you like this video. Thank you so much.